The role of progestins in active breast cancer. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years and in clinical practice for 27 years. There's a recent paper that was published this year, January 2026, where they were looking at the addition of a progestin, megestrol, in women that say have a diagnosis of breast cancer, they're waiting for surgery, and they decided to give them letrozole, the hormone treatment in these hormone positive breast cancer cases, and along with the progestin. And they actually noticed that side effects were better, hot flashes were less, and there was also a sign or signal that there was some positive signs of impacting the cancer. And there's apparently another trial where they're recruiting in premenopausal patients as well, using prometrium, bioidentical progesterone, but that data is not out yet. What it reminded me of was of a case that I saw several years ago, where this woman was premenopausal. She has a diagnosis of breast cancer. As soon as that happened, typically these hormones, if they were on, so she was on a progesterone, was stopped. And she was on it because she had very heavy menstrual cycles. So this was one of the treatments that regulated that and kept her life more comfortable. And then so what happened when stopping it, her cycles went like more heavy. And then when she saw the surgeon, the anesthesiologist was like, I don't like this heavy bleeding, and I'm not going to okay surgery. And what ended up happening was, like, the oncologist then referred to like a gynecologist. The gynecologist was like, I don't know, I'm not comfortable with giving back progesterone. It's this legal thing back and forth, which I understand. And then eventually, because time is ticking away, it was decided to put her back on the progesterone. And guess what happened? So first of all, the cycles normalized again, so her quality improved. But what was interesting was that when there was another ultrasound done, the breast cancer mass was actually half the size. And I remember her oncologist, who I feel is very open-minded. He's senior, is a really great guy. Even he commented that he was surprised on the finding. And so I think what's happened is that this doorway has opened up again on the use of hormone replacement, because years ago, like 20 years ago now, there was some negative studies, and that really just closed this doorway. And now this doorway is opening up again, and you're starting to see now some data, some studies, while preliminary, implying that, hey, these might not be so bad in groups of patients. Again, the long-term numbers aren't there, but that's what's happening. And what we've done in select patients, obviously carefully selected patients, we've walked this path with them. So we're quite familiar with the subject area and some of the controversies, because some women honestly really do benefit from hormone replacement, and from a quality of life perspective, and it might be doing more. And now what we're starting to relearn again is that progestin or progesterone treatments might actually help to calm the cancer down too. It might help with reoccurrence risks, for all we know, and perhaps combined with like other endocrine treatment, aromatase inhibitors, etc. So people forget that actually progestins were once used in mainstream medicine for more advanced breast cancer. So I bridged that world of when there wasn't a lot of options then of hormone treatments. And so megestrol was actually on that radar more, but now it's kind of died down. Not to say it didn't work or help, it definitely worked in a group of patients. But anyways, this is more just to create this light that, the use of progesterone, progestins in breast cancer may not be so controversial. Personally, I tend to favor more the bioidentical, like say the prometrium types. We actually use those in advanced endometrial cancers, which I think it's quite encouraging in our opinion in select patients. But anyways, in breast cancer, I think there could be a doorway which includes an early use breast cancers as well, and it might improve quality of life, great for sleep, and it might even help with reoccurrence risks and impacting the cancer as well in a good way.